Thank you for joining us today at our daily update at the EMA office here. As you know, we've started our daily briefings back today because of our numbers. And we've got a special guest with us today that the chairman's going to be introducing. So we want to get to him right away, and then we'll give you the daily numbers, and you can see why we're starting to do these daily briefings. Chairman, welcome.
Thank you, Herb. So today we're fortunate to have the president of Memorial Hospital back with us. We didn't necessarily think that we'd have to have Mike McManus come back. We thought that our numbers would stay manageable, but they seem to be going up. They are going up. And so, Mike, welcome back to our briefing. Let's talk a little. What are you seeing at your hospital? Are people wearing out? Are they starting to suffer a little bit of fatigue because of this?
Oh, definitely. There is some fatigue going on. We've been at this since March, and to give you an idea of the most recent trends, April and May the numbers were high, and they started dropping in June, and we cautiously started to reopen our hospital to elective cases and things like that end of May, middle of June, and so June 25th. It was a Thursday. It was kind of a big day for us. We were below 10 patients in the hospital. Nobody in the ICU ever COVID. Then June 9th, you see it bounce back up into the 20s. Then July 9th, I'm sorry. July 16th, we went back down to below 10 again. And then today, we're back up into the 20s. Now, when I use these numbers, I want to clarify. It's COVID positive and PUIs. People under investigation until we determine they're positive. And so the takeaway that we have on this is we will continue to see this. We will continue to see this going up, going down, going up, going down into the foreseeable future, probably for the rest of the year. And we're also seeing, I'm on these calls every day at 11:30, we're seeing the region, the whole St. Louis metro region increasing in terms of the numbers. The numbers are higher right now than they were in April and May. Now that's partly because of more testing, so you're coming up with more positive cases, but it's growing. And it's impacting our ability to keep we're concerned that it's impacting our ability to keep our elective side of our business open. We are concerned.
So as we see this going up and down, it seems like those peaks are getting higher, which means that at some point we're going to have to pull back on some of the openings that were made, because we've got to get a handle on this before it starts peaking to a point where the hospitals can't handle the caseload. What are you hearing out there? I mean, there are people who say, I'm not going to wear a mask, it's my right not to wear a mask. What does your staff think about that when somebody's cavalier and they're a disbeliever? They think that COVID is just the flu.
Well, we were talking about this this morning in a hospital, actually last week too. And I want to kind of advocate for our staff, and that I think they're frustrated. There isn't a person I know in healthcare who thinks that this is a hoax. Not a doctor, not a hospital administrator, not a nurse, not anyone in healthcare that I know of that thinks this is a hoax. And not wanting to wear a mask is I just can't understand it, because it's a simple precaution and it's showing that it shows benefits. So so this is a little bit personal for me, in that I want to be supportive of our staff, because I think that folks that are thinking this is like the flu or is a hoax maybe aren't being respectful of our healthcare providers and people that are going to take care of them in time of need. These are the same people that you go to for your regular doctor office visit, that you go to get your knee fixed, your heart fixed, your this, your that, and we trust folks for that. Yet we question whether they're valid on this issue. I just don't understand that.
And some of the people that won't wear a mask and they get infected, they're showing up on your doorstep, and your nurses and doctors are having to take care of them, because that's the duty, and that's the Hippocratic Oath, and that's what is done. But your doctors and your nurses are putting their lives on the line. You've had staff that has been infected by people that have checked into your hospital.
You're right, and I'm glad you brought that up, because the other thing I hear sometimes is, well, this is like the flu. Well, there's a vaccine for the flu. Now, it's not for every strain, but they pick out the three, highest or whatever, or suspects. There's no vaccine for this. There's a history with the flu. There's really no history with this yet in terms of knowing what to do. The way you're contagious is different. There's a lot of differences. There is been in healthcare for over 30 years. We treat the flu every year, we've had a couple of folks that work at the hospital who came down with COVID, who ended up being in our ICU for several weeks. I can never recall in my entire career having employees get sick like this from the flu, and we take care of that every year. So I do think there's a difference.
So we seem to have hit a ceiling a little bit on testing, at least. We're now having to make appointments at
Yes.
CVS, Walgreens. There are limitations. Do you foresee that opening up in the future? I would think that, and I know it isn't something, if you could wave a magic wand, you would make as much reagent available as necessary. What can we do who can we talk to try to get this reopened? Are there any areas that are doing anything innovative that we're not doing here to increase the amount of testing that's available?
Honestly, Mark, not that I know of. It really is unfortunate that the lab companies are not, again, this is just my opinion, are not stepping up and providing the adequate testing that we need as a country. We have some testing capability, but we lack reagent, so we have to use it sparingly for emergency cases that come into the hospital and do rapid testing. So we get someone in the middle of the night that comes in that has a belly pain or something like that, and we have to take them to the OR. Well, to test that person rapidly, we can't wait for a 24 or 48-hour turnaround. So we have to preserve that testing capability for that versus testing in the community or things like that. And I think it's unfortunate as a nation that we don't have the right testing.
So you're going to talk about the numbers in a little bit, but 52% of the people tested today are that showed up as positive are under 40. Mm-hmm. Those under 40 seem to be better equipped physically to handle COVID. Isn't the real danger, though, the fact that they're going home and maybe their parents or their grandparents, people who are vulnerable to this illness, are there and they're infecting those people?
Yes, the numbers are growing in the younger population. Again, I'm on these calls daily, and for the St. Louis region, we're seeing that. We're seeing that a larger percentage of younger folks are testing positive, but they're putting everyone else at risk. They're putting their grandparents at risk, or any people they work with at risk. And again, I think it comes back to personal discipline and wearing a mask and putting the good of the good of the society ahead of maybe your own individual thoughts on this issue.
And wearing a mask, it's been proven that if both parties are wearing a mask, the transmission rate is minimal.
That is correct. So the one thing, the takeaway as a healthcare provider and advocating for our folks who are on the front lines, I would implore people to wear a mask and implore people to observe social distancing. This isn't a political issue. This is a health issue for your neighbors.
Herb?
Oh boy, don't open up the door for me. Mike, it's a pleasure to be here. Just some questions that they've got coming in today. Rumors, as we all know, it's the flu, it's a hoax. The one that's floating around out there now, the hospitals are listing everything as COVID so they can get more money.
I wrote that down as some of the things I've heard about. It'll go away after the election. Hospitals coding to get more money. The media is driving it. All those kind of things, which it just it's kind of hard to fathom. But that's not true. First of all, just any hard factual nutsy boltsy kind of thing. Whether it's Medicare or any other insurance payer, we do not nearly get paid for what it costs to take care of a COVID patient as a hospital. And we've run the numbers. So just in terms of that very specific thing, the answer is no. Also, no, we're not coding so we get more money, because we're not getting more money for that. Now, we do get CARES Act money that is supposed to replace what we have lost, but it doesn't on the elective side. Again, for a long period of time, we were down 40% of our total revenue because we weren't scheduling knee replacements, hip replacements, things like that. And that's what the CARES Act money was supposed to supplement and help. It doesn't replace it dollar for dollar, but it helps, certainly, and we're grateful to the government for that. But that's absurd. We're not coding because of to get more money.
Hospitalization, one of the other false rumors out there that everybody's saying is the hospitals can't be hurting because they laid people off. Can you explain in detail a little bit more when you talk about having to be prepared for those selective surgeries, or like you said, somebody comes in with a stomach problem and has to end up in surgery? Can you kind of elaborate on what a hospital has to go to meet that surge capacity?
Sure. Well, I'd like to talk about the furloughs first. A lot of hospitals had to go through furloughs, whether it was hospitals in the BJC system, HSHS, SSM, Mercy, et cetera. And the reason is overnight, like a lot of businesses, when you lose 40 to 50% of your revenue, you have to look at ways to preserve cash, unfortunately. One of them is your capital spending, because that's bricks and mortar, buying equipment or that, and that's an easy thing to do. Well, we won't plan that renovation. We'll just defer it for a year, things like that. Instead of renovating your kitchen this year, you wait till next year. That's an easy one. The harder ones are areas that you have to affect employees and affect people. And that's why most hospitals chose to do furloughs, because they knew this would come back and the elective work would come back, and just a matter of time. And I will say we've recalled half of our folks already, and as the elective business built back, by and large, it wasn't the nursing staff, it wasn't the folks for the surge capacity, it wasn't on the inpatient patient care side, I can assure you that, and those areas. It was probably mostly in the support areas. And administrative areas where we had to do that, and it's planned to be temporary. And again, like I said, we brought back 50% of the people. But the thing is, if COVID comes back and we see our volumes go up from what they are today, that compromises our ability on the other side of our business of the knee, the joint replacements, the cardiac procedures, those kind of things, to continue to be able to staff that, because we were getting back to 80 to 90% of our patient volume on that side. But if COVID jumps up, it compromises our ability to continue to build that and keep that and maintain that. That's why we're concerned.
Well, and I think the other thing that's worth mentioning, you see a lot of people saying, well, yeah, I may be symptomatic, but I've got a mild fever, or I've got some of the slight symptoms, but that could change pretty rapidly. So somebody who may be sitting at home for a day or two, just having a little temperature, then all of a sudden they start going down, they're going to end up in the hospital.
Certainly. And two kinds of patients like that. One is a non-COVID patient. We saw that early on, where folks stayed away from the ER. We asked people to stay away if they could, and God love them, they did. But if you're not feeling well, you wait a few days until it becomes unbearable and you show up, and that becomes a more serious issue than it maybe could have been. And that's not good for anybody. And that's all COVID-driven, direct result. And then you have the COVID patient who, like you said, might be not feeling great and getting worse and hanging around until they absolutely have to come to the hospital for treatment. We get about in this low ebb time frame, we still average 8 to 12 people coming in a day that we test in our ED that potentially may have COVID.
Right, so it's a balancing act that you got to do. And I was glad you brought up about the mask, because that's a big topic of conversation. Your staff, but I look at it also from our first responders that are out there. It's kind of a slap in their face when I hear people say, "Yeah, I'm not going to wear a mask." Well, why are you wearing a mask? But our first responders, our paramedics, our EMTs, the nursing staff. If you don't have any respect for yourself, you need to have respect for them and people around you. So I was glad to hear you say your staff is kind of to the point where they're saying, why aren't our citizens respecting what they're asking to be done? Because it's been proven that the mask is our best defense that we have out there now. Is it 100%? I don't think it is. There is no 100%. We've all heard that. But we haven't had one person such as yourself or any of the physicians that came on these briefings that said you don't have to wear a mask.
Right. Right. It's interesting, and I'm going to apologize in advance, maybe, but the idea of patriotism in this country, you'd like to think it's one nation undivided, okay, that we're all in this together, versus this is my right to do or not to do, and I'd like to think it would be the first one.
You can't smoke inside in a bar or restaurant. That it's that same type of thing. You're asked not to smoke because it affects other people. Mask is the same way. And we're not just saying for St. Clair County. Just because we're saying don't forget your mask here, when you go to St. Louis and you're on the phone and hear about Missouri's numbers, their numbers are, the same as ours, or they have high infection rate there too.
Yes.
So wear your mask wherever you go. This is a universal issue. You can catch it anywhere.
Yep.
And the mask is a good idea no matter where you are.
Yeah, the region's numbers are climbing.
Yeah.
And so no matter, I have one in my car, I have one in my backpack. Always have it.
So in your professional opinion, COVID is still there?
Yes, absolutely.
And it's not going away.
And it's not going away.
Now, and we actually talked about it Thursday on the mask issue. If you'd sit at home and think about how many hours out of the day you have to wear a mask, I think people would be surprised it's not long. We're not asking them to sleep in it. We're not asking them to have it on 24 hours a day when you're at home, when you're driving your car. It's if you get out to go to the store, wear it.
I agree.
Yeah.
Clarification that came in on something you guys were talking about with the CARES money versus cost of a COVID death. The person asks, so because the CARES money is there to offset it, do you get more CARES money? Is your CARES money based on the amount of people you report?
Yes, but it's misleading that there's a standard out there that when they passed the CARES Act, that hospitals that were treating let's say 100 COVID patients or more fell into one category of CARES Act money. Hospitals that treated 100 patients or less fell into another category. I can assure you that is not the driving factor of how things are coded. What the intent of the legislation was, that the CARES Act money should help those hospitals that are shouldering the larger burden of taking care of COVID patients, and it doesn't nearly. I ran the numbers. It's been a month or so, so I please don't take these to the bank, but. The CARES Act was probably $1 for every $2 that we left on that we forgone by closing elective services or something like that. Did not nearly cover.
And the reason for that metric is because you had to give up elective surgeries because we had a COVID surge in this county, and you were making sure there were enough beds for COVID patients. That's why they say that money, part of that money, is maybe there because you have COVID patients. Of course, that's it. That's why you had to give up elective surgeries, and that's how hospitals stay in business or at least that's a big part of your business model.
Absolutely, and there's four hospitals in the BJC system that handle the majority of the COVID patients. Obviously, Barnes Jewish, Missouri Baptist, Christian, and then Memorial. We're probably, the vast majority of all the patients in the system, and we had, it was really more of a staffing issue than a bed issue, Mark. We had COVID patients are very intensive to take care of, require a lot of resources, require nurse-patient ratios that are lower than normal, and things like that. And quite honestly, I am proud of the fact that we took care of so many COVID patients. I am very proud of our staff and the fact that the community chose to go to us, because we were kind of the shouldering a heavy burden for a long time, and I'm happy about that.
And tune in tomorrow, because with us tomorrow will be one of those patients that you saved who had COVID, who was in real trouble, and he's alive today and walking around and able to talk to us about his experience because of the service that he got and the good care he got at your hospital.
Well, Mike, we appreciate you coming in today. It's a good information, and I'm sure our followers, we have a great team of Team St. Clair that follows us. We're picking more and more people up every day because we're getting that word out there, and it's because of good information that you're giving out and the other people that we're having on. I hope is what's spreading that word out there, so we appreciate it.
I'm with you. I did not want to come back.
Yeah.
I wish I
Not because we
have
didn't
to
like
come
your
back.
company. Yeah.
But we're here, and we'll get through it.
Very good.
Thank you
Mike.
very much, Mike. So now it's time for numbers. As we know, Sam is on vacation, which is a nice concept. And someday perhaps I'll be able to partake. But until that point, I'm assigned the numbers today. So today we're up to 27,392 that have been tested. That's an increase of 481 over yesterday. For those that are counting, that's an 8.7% ratio. So of the 42 new positives in the 481 is 8.7%. Those are males and females under the age of 10 and all the way to the 90s. And as I said earlier, we're seeing a large percentage now being under 40. So 52% of those tested, 22 of the 42 were under 40. So that's something to think about when that under 40 is coming around your house and going to see grandma and grandpa or someone who perhaps is immune compromised. You gotta consider that people under 40 are catching this at a pretty heavy rate. As far as negatives go, we're at 24,280 negatives. 17 tests are pending. Deaths remain the same at 148. And those that have completed the IDPH required 14-day quarantine period are 2,149. State totals, 2,279,109 have been tested. Of those, 162,748 are positive. That's an increase of 1,173. And as far as deaths go, they increased by 6 today, unfortunately, and that number now stands at 7,301 in the state of Illinois. Hospitalization numbers, now those are those that are currently in St. Clair County hospitals. There are 39 in the hospital that are COVID-19 related patients, and today, a good number, 0 of those patients are on ventilators. In the congregate living facilities in outbreak status, and this includes residents and staff members with 2 or more at a facility, and remember these are cumulative numbers, these have been adding up since we started keeping track. Adaptive Illinois has 2 cases and 0 deaths. Atrium of Belleville, 2 cases and 0 deaths. Autumn Meadows in Cahokia, 6 cases and 0 deaths. Brea of Belleville, 58 cases and 7 deaths. Brea of Cahokia, 34 cases and 3 deaths. Bradford Place in Swansea, 4 cases and 0 deaths. Caritas Family Solutions in Belleville, 15 cases and 0 deaths. Caseyville Nursing and Rehab, 8 cases and 0 deaths. Cedarhurst of Shiloh, 13 cases and 0 deaths. Cedar Ridge of Lebanon, 75 cases and 10 deaths. Cedars of Lebanon, 2 cases and 0 deaths. Colonnade, 5 cases and 0 deaths. Don Bosco Home in Belleville, 2 cases and 0 deaths. Esquilin Dammert Center at the Shrine, 2 cases and 0 deaths. Four Fountains, 104 cases and 27 deaths. Help at Home in Belleville, 2 cases and 0 deaths. Help at Home in O'Fallon, 5 cases and 0 deaths. Integrity Healthcare in Belleville, 6 cases and 0 deaths. Knollwood Retirement Center in Caseyville, 8 cases and 1 death. Lebanon Care Center, 59 cases and 11 deaths. Memorial Care Center, 49 cases and 5 deaths. Mercy Rehab and Care Center in Swansea, 5 cases and 0 deaths. New Athens Home for the Aged, 57 cases and 7 deaths. St. Paul's Home, 54 cases and 15 deaths. Swansea Rehab and Care Center, 41 cases and 8 deaths. And TDL Incorporated Belleville, 4 cases and 0 deaths. Zip code reports for today. 62059, we stand at 8. 62201, we remain at 152. 62203 goes up by 2 today to 117. 62204 remains the same at 93. 62205 goes up by 4 to 122. 62206 goes up by 3 to 281. 62207 goes up by 3 to 159. 62208 goes up by 4 to 172. 62220 goes up by 3 to 252. 62221 goes up by 7 to 270. 62223 remains the same at 125. 62225 goes up by 1 to 12. 62226 goes up by 10 to 316. 62232 remains the same at 66. 62239 remains the same at 25. 62240 remains the same at 6. And 62243 remains the same at 17. 62254 went up by 1 today to 106. 62255 remains static at 8. 62257 goes up by 2 to 17. 62258 goes up by 1 to 37. 62260 goes up by 1 to 30. 62264 goes up by 1 to 63. 62269 goes up by 3 today to 178. And 62285 remains the same at 27. Herb, that's a lot of numbers.
It's a lot of numbers. Poor Tammy's probably getting wore out. But back to the mask, a lot of activity on our page of stores that aren't requiring them. We've got a graphic we're putting up now on some of the corporate stores that have put out notices that they are requiring mandatory masks to be worn. And of course that stirred another big, well, I'm not going to go there and shop. Well, again, that's your right if you don't want to. We want you to support all of our local stores, but that's your choice. You hear what we're telling you, wear a mask. The list that you see on there are the corporate stores that are saying if you want to come inside, you have to have a mask on. There was talk about, well, yeah, but once people get inside, they're taking them off. Well, we've been told by some of the managers of those stores that they will have store people watching that, reminding people about social distancing and about the use of masks. So I'm feeling a little bit better that our corporate businesses are stepping up to the plate, saying that we feel that this is serious and we're going to take it serious. Mobile testing tomorrow, they will be in Dupo at the Dupo Park. They'll be there from 10 a.m. till noon, and then 1 to 3 right there in the Dupo Park, and that's been put out to the Dupo, East Rondelet, but anybody can go there and get tested. So we encourage you to take advantage of that. And then on the next day, Wednesday, they'll be at the Moody Park in Fairview Heights the same time, 10 to noon a.m. and then 1 to 3. So if you can make it there in the Fairview Heights area, that's the best place to go to get that. You already mentioned that tomorrow our guest is going to be Mr. Anderson. He was on several weeks ago when he got out of the hospital. He had to go back in for some more work at the hospital. He'll talk a little bit about that, but we thought it was important to have him come back on and tell his story of what he's had to go through since getting out of the hospital doing his rehabilitation.
Just because you get out of the hospital after recovering from COVID doesn't mean that the road ahead isn't a long one.
Yeah, he's still not back to work, and like I said, he's got a story to be told, and I think it's interesting getting back on. And then what we're scheduling too, since we are doing the daily briefings now, which we didn't think we had to, as you heard the chairman say, but we've got some school superintendents for the rest of the week that school is a hot topic right now. So we've reached out to Susan Sarfati, and she's helping us arrange that. We'll have some of the superintendents, I think District 189 is going to be here, and several of them throughout the Belleville, throughout the county is what we're trying to get in, because we know there's a lot of parents out there that's wanting to know what those plans are. A lot of them have received them, but you may have some questions that you want to directly ask the superintendent. So we'll fill those days with superintendents to come in and answer those questions. I know it's been a long day today, but we had a lot to talk about since we are back for our first daily briefing. And believe us, you heard the chairman say it, we didn't want to be here on the daily. We were happy with the weekly, but we're watching these numbers. We'll continue to watch them each and every day because we're all in this together. Team St. Clair, I was telling us, the staff before we went on, I'm seeing more and more people come to the page. So I know Team St. Clair is spreading the word. And we're trying to answer each and every one of your concerns and questions. We did that all morning today. So have patience. We've kind of adopted, and we heard it from IDPH's broadcast, the 3 W's. Wear a mask, wash your hands, and watch your social distancing. It's real simple to do. As I said, it's not a lot of hours in a day that you have to wear that mask. So we'll be back here in just a little bit with the ladies to translate this into our Spanish communities, and then we'll be back here tomorrow afternoon at 3:30 with Mr. Anderson. Have a good evening.